Hello everybody and welcome to this episode of Virtual Coffee with an OSCE Educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and also the owner of the OSCE Accelerator learning programme. And we are here today to pick the brains of the lovely Beth Vincato, who is one of our resident OSCE educators. So we get lots of questions on our social media about the OSCE test, about different stations, and we really just wanted to take the opportunity today to deep dive into the peak flow station, and we've got Beth here to help us. Beth is an OSCE educator. She's been teaching OSCE for over 5 years now at an NHS trust. She's supported literally hundreds of international nurses through the international OSCE test, and we are delighted to have her with us. So thank you so much for joining us, Beth. Can you walk us through the peak flow station so our lovely international nurses know what to expect?
Okay, so hello and welcome. So for this procedure, you're going to have to take a peak flow. If you haven't done this before, obviously you need to learn what it is and how to do it. So it's quite like a basic measurement to measure the expiration of the patient, so how much they can breathe out. So you're going to have a mannequin to do this, and you will need to explain to them what to do, and you'll need to take some readings from them.
Wonderful. How long is this station? How many minutes do you have to complete it?
So it's quite a quick one. It's 8 minutes, but you should be finished in time.
Okay, wonderful. Any documentation required for the station?
So the documentation itself is quite straightforward. You're just going to have quite a basic chart. You'll need to take 3 readings from your patient. So you just need to write those down, and also you'll need to take the highest reading.
And is it always the highest of the 3 readings that you take?
Yes, the highest of the 3 readings. So that's to measure their best reading.
Okay.
So the higher the reading is, the better.
Okay.
Also, you're going to have like a graph there. That's to interpret your results. So in order to calculate what the patient's results should be, you need to have their sex, if they're male or female, their height and their age. So that all should be on your paperwork. If not, or if you find it difficult to find, just ask the patient, that's fine. So according to that, you should be able to calculate what their average results should be.
Okay.
And then you need to discuss with the patient, if their reading's okay or if it's below average or above. So if it's above the expected, that's really good. And if it's below, that's not very good. So the way I would suggest to remember this is, if you've got a patient like, let's say they do a lot of sport, they're young, they're like an athlete, they're going to find this breathing into the tube really easy to do, aren't they? So we're going to get a high result. If you think about one of the patients we have on the ward who's probably very sick, they're short of breath, they're going to find it really hard to do. So they're going to get a lower result.
And do you have to recommend any interventions as a result of their high or low reading, or is it literally just a case of explaining to them that they're average, above average or below average?
So I think you can, if you know the interventions, like your respiratory nurse in your previous experience, go into those in more detail, but it's not actually required. So if it's low, you can just say, I'm going to refer to the doctor, I'm going to escalate. That is fine. That's
acceptable. Wonderful. And equipment wise, what is required at this station?
Okay, so for your equipment, you're going to have the mannequin. They need to be sat up in the chair or on the bed. You're going to have your peak flow. Also, you've got a mouthpiece that you attach to that. So it will either be a cardboard one, which is disposable, which you can put in your yellow bin, or a plastic one, which obviously needs to be washed.
Sure.
The peak flow is single patient use, so that means that is to stay with that patient, not to be used for other patients afterwards.
Got you. And how would you recommend best preparing for this station?
Okay, so definitely learn the steps to performing the peak flow so you can explain it fully to your patient and correctly. Sometimes I find nurses find this a bit confusing, so definitely practice this one. So I'll go through it now for you. So get the patient to inhale, take a deep breath in, then you want them to put the peak flow in their mouth, make a seal, and then they need to breathe out as hard as they can in a short, sharp puff. So short, sharp puff, and that's going to give you the reading. So there's a needle on there which is going to move up, and then you just need to make a note of the reading. You then need to reset the needle to 0 and do the same thing again.
Wonderful. And at this station, it's a mannequin, so will the pin actually move, or will it just be the examiner telling you that the reading is such and such?
Yes, I forgot to mention that, so you're right. The examiner is either going to move the needle for you or tell you the reading.
But in practice, the dial would move. That makes sense.
Of course. Yeah.
And in terms of any reasons that a candidate might get a mistake on the station, get a fail on this station, I know it's probably one of the more straightforward stations, but what have you seen that's perhaps not gone quite right at this station?
So forgetting to reset that needle in between readings, you're not going to get that accurate reading if you don't reset it. Not recording your results, it's a simple thing, but if you leave them all to record afterwards, you're going to forget and make a mistake. Just do it as you go. Also getting confused when you're explaining the technique to the patient and maybe making some errors with that.
So almost practice that communication again and again. Any other top tips before we wrap up for this station, Beth?
So for this one, as I said, you might find you make mistakes when you explain to the patient. So what I would recommend, I know it's a bit of a pain, but explaining to the patient each time you do it. So one time before you start, obviously you're going to explain to the patient your procedure, and then you're going to do 3 readings. So talk them through it each time. This gives you 4 times to get it perfect. So don't worry if you slip up on one of them. Okay?
You've got the other opportunities.
You don't want to be resitting this OSCE exam. You want to get it done, don't you?
Wonderful. Great tips as ever. Thank you so much for joining us, Beth. Much appreciated, and we will catch you next time.
Okay, good luck with your exam, everyone.